This video will discuss the second question from the 2013 BMAT. The statement given is that there is money to be made from not curing disease, and the guidelines given to help you plan your essay are firstly, to explain what you think is meant by the statement, secondly, to argue to the contrary, and then thirdly, to state to what extent you agree that there is money to be made from not curing disease. Before we begin explaining this statement, it may be helpful to discuss the key terms involved. The first term, money to be made, indicates monetary profit. And who's making this profit? It would be whoever is curing the disease or treating the patients. This could refer to players like pharmaceutical companies, hospitals, doctors, or even healthcare systems as a whole. And what the statement is arguing is that not curing the disease, meaning keeping patients sick, perhaps by treating their symptoms but not curing the actual cause, thus allowing the players to treat them for longer, would be profitable. And we've already discussed the players involved. Why don't you pause and have a go at coming up with an example sentence to explain the statement? One that I came up with was that the statement tries to argue that healthcare systems, hospitals, companies, and doctors can profit from keeping patients sick but providing care, compared to curing them definitively. Now, before we begin arguing against the statement, why don't you pause and have a think of some reasons that the statement may be untrue before we discuss some examples that I came up with? The first one that I came up with was that there is money to be made more from curing disease. This could refer to patented drugs, which incentivize pharmaceutical companies to invest money into curing diseases, as coming up with a curative drug for diseases like cancers or MS could be highly lucrative. Furthermore, even for doctors, curing diseases and being a better doctor with a better track record would attract more patients. This would also go to hospitals and incentivize them to have better doctors, and thus allow them to make more profit, which shouldn't be the aim, but would help disprove the statement. Why don't you pause and have a go at coming up with an example sentence for this? One that I came up with was that there is more profit to be made in producing drugs that perform better, as customers are more likely to buy them. The same would apply to patients going to and paying more for doctors and hospitals that have better track records. Another line of reasoning that I came up with was the financial burden placed on public healthcare systems by not curing patients, as sick patients cost money, as you have to treat them and allocate beds and service to them, and also it reduces the productivity of the population as a whole. Why don't you pause and have a go at explaining this line of reasoning? One way I came up with was saying that treating sick patients, which involves allotting beds, doctors, nurses, medication to them, is a huge burden on a healthcare system. Over time, it would be more productive and profitable to cure these patients. Now we move on to the third part, which is to argue to what extent we agree with the statement. We've already discussed the arguments against. Some arguments for would involve things like selling medication, as if a disease is cured, people no longer have to take medication for that disease. But coming up with drugs that just treat the symptoms, but not curing the disease, would be more profitable, as patients would have to take them throughout their lives or for a much longer period of time. Secondly, if we have a private healthcare system, it doesn't face the same burdens of a public healthcare systems and would just make more money if there are more patients and could scale up with and treat more patients as necessary. So it would not benefit from curing the patients. Why don't you pause and have a go at weighing the arguments on both sides and coming up with an example paragraph that agrees with the statement? One that I came up with was that there is some truth to the statement. If a disease is cured, patients no longer have to be taking medication for it or paying for care. In those cases, it would be more profitable to treat their symptoms but not cure the disease.